Hello, and welcome to the first installment of the 2022 Expanding Research Partnerships webinar series. Today's webinar topic is promoting partnerships to explore the impacts of technological change on work and well-being, with a focus on work arrangements. Now, it is my pleasure to introduce Dr. Sarah Feldman, Niosh's Associate Director for Research Integration. Sarah?
Thank you, Nicole. Can you hear me okay?
I can, yes.
Great, thank you. Thank you. And on behalf of Niosh, I'd like to welcome everyone to the first installment of our 2022 Expanding Research Partnerships webinar series, exploring how technological change is impacting work and well-being from different perspectives. Today, we're pleased to bring together partners from occupational health and safety research, industry, and academia to consider the impacts of technological change on work and well-being with a focus on work arrangements. It is my pleasure to introduce our distinguished panel. I will briefly introduce all of our speakers now so we can move quickly between presentations. Please see the Niosh Expanding Research Partnerships webpage for their full bios. Our first speaker today will be Renee Panakrian from Niosh. Renee is Chief Economist and Director of the Economic Research and Support Office in the Office of Director at Niosh. She also co-manages the Niosh Healthy Work Design and Worker Wellbeing cross-sector program. Her interests include understanding how to improve the design of work, management practices, and the physical and psychosocial work environment to enable workers to thrive and contribute productively at work, at home, and in society. She's particularly interested in understanding the economic factors that affect work arrangements and the effects of work arrangements on the well-being of workers and their families. Renee joined Niosh in 1996 as a postdoctoral prevention effectiveness fellow. Our second speaker today is Scott Debeau from Randstad. Scott has 19 years of leadership experience in risk management and occupational safety. As a safety professional in non-traditional employment settings, he sees tremendous opportunity for systems improvements that can create and maintain safer work environments. Scott works to align people, teams, and industry resources for improved safety within the joint employer community and devotes much of his time to developing safety leadership to address critical workplace risks. Scott currently serves as the practice leader for risk safety at Randstad, a global leader in the human resources services industry that provides workforce solutions in the areas of engineering, IT, legal, life sciences, healthcare, and manufacturing logistics. Randstad operates with the belief that how we operate as a company should move society forward. Scott is a professional member of the American Society of Safety Professionals and serves on the Niosh NORA work groups of contingent labor workforce and traumatic injury prevention. And our third speaker today is Lorraine Conroy from the University of Illinois at Chicago. Lorraine is professor and division director of environmental and occupational health sciences at the University of Illinois at Chicago School of Public Health. She serves as director of the UIC Center for Healthy Work, which is a Niosh-funded center of excellence in total worker health. Her research interests include understanding how working conditions and work arrangements associated with precarious work impact the health of workers, their families, and their communities, and in intervention strategies to turn unhealthy work into healthy work. Lorraine is co-director of the Occupational Safety Program and director of the Pilot Projects Research Training Program at the Niosh-funded Education and Research Center at UIC. She's certified in the comprehensive practice of industrial hygiene by the American Board of Industrial Hygiene with more than 30 years of experience in research, curriculum development, and teaching in occupational and environmental health. And now we're ready to begin our webinar. Each speaker will have approximately 20 minutes, followed by a Q&A session after all presentations have concluded. Please put your questions in the Q&A chat at any time during the webinar and indicate the speaker to whom your question is directed. And now, without further delay, I'd like to invite Renee to share her screen and slides as we welcome her to our virtual podium. Renee?
Okay, can you see my full screen?
We can, yes.
Excellent. So thank you, Sarah. And before I start, I want to acknowledge all the work done by others on this topic. And I specifically want to thank all the Niosh economists and Dr. Howard for his continuing trailblazing. So there are several types of work arrangements between those who perform work and those who provide jobs. While standard arrangements continue to be the most prevalent, some types of non-standard arrangements seem to be increasing. In this presentation, we provide an overview of economic factors that affect worker well-being, including work arrangements, definitions, classification, and prevalence of non-standard work arrangements and related concepts. And we also provide examples from the literature on their impact on worker well-being and their role in the future of work. Examples of economic factors that affect worker well-being include costs and incentives related to voluntary and mandatory safety and health policies, the employment and unemployment situation, management practices, including work organization, job design, existing and emerging technologies, and work arrangements, including those of employed, co-employed, and non-employee workers. In a confusing sort of way, typically those are referred to as standard, independent contractor, on-call, temporary help agency, and contract firm workers. Additional dimensions of work arrangements include temporary or contingent and low-wage arrangements, pay and benefits, including access to health insurance, and work schedules. We consider work-related outcomes in a holistic way that extends beyond injury and illness reductions. Each category of outcomes may be affected by other categories of outcomes. For example, a worker might leave a job, which is an economic outcome, after experiencing job stress, which is a proximal outcome. And even though we focus on worker well-being in this presentation, it is important to remember that outcomes for family members, communities, and society overall should also be considered. I wanted to mention that other economic outcomes, we include outcomes expressed in monetary terms and outcomes expressed in quality of life terms. Because there are no commonly accepted definitions of work arrangements, it is hard to assess their prevalence and associated research findings on work design and worker well-being. We briefly discuss a two-tiered approach to classify work arrangements. First is a legal approach to classify employed, co-employed, and non-employed workers. And second, an approach based on important characteristics of all work arrangements that vary by arrangement. We mainly discuss workers' main job, on which most data sources collect information. In a standard arrangement, the employer controls the manner and means by which the worker provides services and is responsible for the safety and health of employees. Types of other arrangements include agency, that involves co-employment and shared responsibility for workers among employers, contract, that involves a business rather than an employment relationship, and gig arrangements that are intermediated by digital online platforms. An example of a household survey using such an approach to classify workers is the Contingent Workers Supplement of BLS, and I will be referring to this as CWS. Again, this survey defines non-standard arrangements in the categories of temporary help agency workers, workers provided by contract firms, independent contractors, and on-call workers. And I will tell you about on-call workers in a minute. According to a 2020 National Academies of Sciences report, to reduce misclassification, CWS includes questions about self-employment and obtaining customers on one's own. The types of arrangements used by CWS allow classifying a responder's main job into mutually exclusive categories. And those don't include on-call workers, who really should be classified in a second-tier approach that I will tell you about, because on-call worker or work relates to work schedules. So in terms of the mutually different categories, these types of arrangements include employees not in a non-standard work arrangement, in other words, in a standard arrangement, workers in intermediated or co-employment arrangements, including temporary agency workers and contract firm workers, and those who are not employees or are self-employed, including independent contractors, and the self-employed who are not independent contractors. In addition, On-demand gig work is a hybrid of work by contract firm workers and independent contractors. So we need to distinguish between gig workers who are W-2 employees and gig workers who are in self-employment or non-employee arrangements. The 2020 NAS report provided recommendations for improved data collection. Existing commonly used surveys, such as the General Social Survey and its Quality of Work-Life Supplement, or QWL, I will be referring to this throughout this presentation, and the National Health Interview Survey and its Occupational Safety and Health Supplement. They include, those surveys that are commonly used include a single question on work arrangements, and in some cases may group together workers in different non-standard work arrangements. For example, the public release for the 2015 National Health Interview Survey data grouped together agency and contract firm workers. The single question used by the surveys includes temporary help agency workers, contract firm workers, independent contractors, and on-call workers, and workers in standard arrangements. These surveys also collect data on worker well-being and work characteristics in standard and non-standard arrangements that are important determinants of worker well-being and included in the second tier classification approach that includes information on job security, work schedule, compensation type, earnings level, security, and benefits. So concepts related to work arrangements help better understand these arrangements and include contingent work and work precariousness. CWS uses 3 definitions of contingent workers listed below from narrowest to broadest, and I will only mention the broadest or estimate 3, which is workers who do not expect their jobs to last. There is no standardized definition of work precariousness, but its characteristics include insecurity, temporariness, vulnerability to unfair treatment, lack of ability to negotiate pay, benefits, and work schedule, lack of ability to take leave, and lack of a social safety net, including unemployment and workers' compensation insurance. Information on multiple jobs held by a worker is important to understand work arrangements and worker well-being. Definitions of multiple job holders vary among sources. I will mention just one example, the Census Bureau's LED, which defines a multiple job holder as anyone who holds 2 or more jobs in a quarter, and at least one of these jobs is a long-lasting, stable job. Also, it is important to understand all the jobs held within a household, as also recommended by the NAS report. For example, access to benefits by one household member might also enable access to benefits by another household member. Here I present statistics from CWS and a variant survey by Rand Princeton. I will be referring to this as Rand survey. According to CWS, the overall prevalence of non-standard work arrangements increased from 9.9 in 1995 to 10.7 in 2005, and then decreased to 10.1% in 2017. Even though the Rand survey was based on CWS, the definitions of work arrangements by these 2 surveys were slightly different. Rand-based estimates showed that 15.8% of workers were in non-standard work arrangements in 2015, up from the 10.7% from 2005 CWS-based estimate. However, the 2017 CWS-based estimates were lower than those from the 2005 CWS, suggesting no increase in the prevalence of non-standard arrangements. Subsequently, Katz and Kruger in 2019 examined the potential causes of this discrepancy. They revised their overall prevalence estimate downwards to 13.7. That would be based on the Rand survey, and it's shown in the very last cell of the table, the last column, and adjusted BLS estimates upwards. I didn't include those in the table to make them more comparable to the revision, and concluded that there were likely had been a modest upward trend in the share of the US workforce in non-standard work arrangements during the 2000s. The Rand survey included questions on gig work obtained through online intermediaries and found that 0.5% of workers were working through such intermediaries in 2015. In 2016, Smith used data from the same year from the Pew Center and estimated that 8% of Americans earned money from online gig platforms in the previous year. And data from our now very familiar 2017 CWS indicated that electronically mediated workers accounted for 1% of all workers. However, BLS noted that these questions did not capture information as intended, and consequently, the NAS report from 2020 provided BLS recommendations for improved measurement. So based on the estimates above, the prevalence of electronically mediated work likely ranged from 0.5% to 8% during 2015 to 17. CWS data indicated a downward trend in the prevalence of contingent workers between 1995 and 2017, regardless of which of the three alternative definitions of contingent worker was used. The broadest estimate 3 decreased from 4.9% in 1995 to 3.8% in 2017. Using 2017 CWS data and contingent worker estimates 3, the percentage of workers in non-standard arrangements who were also classified as contingent workers ranged from 3.2% for independent contractors to 42% for agency workers. In addition, 1 to 1.3% of workers in standard arrangements reported being contingent in 2017. This points to the fact that workers in standard arrangements don't always fare well. And to generate, in terms of the prevalence of work precariousness, to generate a scale to measure this concept, Bhattacharya and Ray used QWL data from 2002 through 2014, and their scale included 4 precariousness components: temporariness, disempowerment, vulnerability, and wages. They found that agency workers reported the highest percentage of high work precariousness. Work precariousness was stratified in 3 levels: low, medium, and high. And independent contractors reported high work precariousness least frequently and less often than did workers in standard arrangements. Again, pointing to the fact that sometimes workers in standard arrangements are not doing as well as others. So it is important to assess the distribution of work arrangements by gender, age, race and ethnicity, and education. For example, again, according to the 2017 CWS data, independent contractors had the highest percentage of white workers, and agency workers had the highest percentage of Hispanic workers. Agency workers reported the lowest percentage of having a bachelor's degree or above. In terms of multiple job holding, Bailey and Fletcher in 2020 used lead data and found that the multiple job holding rate increased from 6.8% in the second quarter of 96 to 7.8% in the first quarter of 2018. This rate rose during economic expansions and fell during recessions. Women held multiple jobs at a higher rate than men. And for men, the rate didn't change much over the last 20 years, but for women, it increased from 7.5% to 9.1%. And now I'm gonna report on a few Niosh studies on work arrangements and related concepts. So the first one is on work arrangements and health-related quality of life. First author is Tapas Ray, data where QWL from 2002 to 2014. And the authors considered work arrangement in the main job and healthy days and days with activity limitations. So the QWL includes questions about physical and mental health, and asks participants to respond whether or not their physical and mental health was poor in the last 30 days. And the same for the days with activity limitations due to poor physical or mental health. So this would be how healthy days and days with activity limitations are defined. So activity limitations are not specifically work productivity losses about work, related to work, but include work. So they examined the association of work arrangement with a variety of organizational and other work characteristics and concluded that occupation, industry, hours of work and shift time, type, and part or full-time status were significantly associated with work arrangement. This slide shows that independent contractors and on-call workers were significantly less likely to be stressed than workers in standard arrangements. And here for workers in standard arrangements and for independent contractors, the authors observed significant association between perceived job stress and reported unhealthy days. For workers in standard and agency arrangements, the authors observed a similar association between job stress and reported days with activity limitations. Now, this is a study I mentioned before, again, led by Anasua Bhattacharya. It's about work precariousness, job stress, and health-related quality of life. The data are, again, 2002 to 2014 QWL data. They constructed the work precariousness scale that I mentioned before. And they found statistically significant positive associations between job stress and work precariousness. And also that workers reporting work precariousness were more likely to experience more unhealthy days and more days with activity limitations due to health problems. This slide just shows descriptive results by sex. So again, the precariousness scale was divided at 3 parts, low, medium, high. And the authors found a higher percentage of workers in precarious work were the females. So this will be the, if you look at the high column, the 33.65%. And this table shows that workers in the top 33% of the precarious scale were 57% more likely to report experiencing job stress than those in the bottom 33% of the precarious scale. Workers in highly precarious work reported more unhealthy days, so 0.4 days more within 30 days than those in the lowest tertile. And workers doing highly precarious work reported experience a higher number of days with activity limitations. And that was 1.2 more days within the 30 days period than those in low precarious work situations. So here, that's the last study I will mention. It's about work flexibility and work-related well-being. First authored by Tapas Ray, used an additional year of QWL data from 2018. And the descriptive results showed that the prevalence of work flexibility remained relatively stable during the study period. There were 3 indicators of work flexibility, including working at home, being able to take time off when needed, and being able to change schedule daily. Here, the report is about healthy days, and this is calculated as the sum of unhealthy days subtracted from the 3 days, the last 30 days. This is what produces the reported number of healthy days. So working at home increased the likelihood of job stress by 22% and job satisfaction by 65%. This points to the mixed results of these flexibility indicators in terms of health-related quality of life and well-being for workers. Taking time off decreased the likelihood of job stress by 56%, decreased the days with activity limitations by 24%, and more than doubled the likelihood of job satisfaction. And changing one's schedule decreased the likelihood of job stress by 20% and increased the likelihood of job satisfaction by 62%. And we're coming to the close. I'm going to talk to you about the summary of what I presented, the future of work and research gaps. So we discussed the need for standardized definitions and classification of work arrangements, described the 2-tiered approach to define and classify those arrangements. We concluded that the overall prevalence of non-standard work arrangements did not increase, and the prevalence of contingent workers decreased over the past 20 years. And then we discussed findings from selected studies that showed that job stress was an important determinant of other well-being outcomes, for example, activity limitations, and that stressed workers in all arrangements fared worse than non-stressed workers across arrangements. And again, workers in standard arrangements did not consistently fare better than others. So efforts by Niosh and its partners to advance research on work arrangements include plans currently being implemented to address research gaps identified by the Healthy Work Design and Wellbeing Cross-Sector Council, ongoing research aiming to address related Niosh strategic goals, and the development of a strategic plan for the future of work initiative that includes an emphasis on work arrangements. An example of specific efforts to improve surveillance on work arrangements include data currently being collected by the National Health Interview Survey with support from Niosh. So these questions ask about whether employers deduct or withhold taxes from pay, the magnitude of month-to-month changes in earnings, usual shift, ability to change work schedule, frequency of changes in work schedule on the part of supervisors, advanced knowledge of work schedule, and the likelihood of losing one's job in the next year. Information from this data collection can guide data collection by other surveys, such as QWL, and can be analyzed in combination with well-being indicators. And that was actually something that the NAS report from 2020 also supported. And then this is my last slide. These are challenges that include a series of needs. So we need improved surveillance methods to include emerging determinants of well-being, such as flexibility. We need to assess the effects of evolving advanced technologies and worker demographics, gig work, and to a certain extent of flexibility depend on advanced technologies, if you will. We need to assess the effects of work arrangement types and characteristics over the span of a working life, considering all jobs held simultaneously, the sequence of jobs and periods of unemployment, as well as the work arrangements of other household members. We need to determine barriers and aids to implementing cost-effective programs for workers in non-standard work arrangements. We need to conduct intervention studies to assess the cost and comparative effectiveness of programs and trainings to improve the well-being of workers in non-standard arrangements, to assess potential work arrangement-related and additional overlapping vulnerabilities experienced by workers in specific demographic groups. And we need to conduct systematic research on how macro-level external factors such as economic conditions or climate change may affect all types of work arrangement. And that concludes my presentation. I have included a slide with references for your information. Thank you very much. My last slide has the disclaimer. Everything I said is my fault. Thank you for your attention.
Thank you very much, Renee, for that excellent presentation on fundamental concepts related to work arrangements that are going to be so critical to our understanding of this topic moving forward. And if you would stop sharing your screen, thank you. We will invite Scott to our virtual podium and ask him to share his screen and his slides. Scott?
Great, thank you. Just give me one moment to share. Very good. Are you able to see my screen and hear me okay?
Yes, we are. Thank you.
Very good. Well, hey, first of all, a big thank you to the leaders at Niosh to allow us to talk about such important topics today. And it really has to do with care for the workforce, special part of the workforce, the contingent labor community. We've heard terms like precarious, vulnerability, and I believe better care for the workforce is in our future, but it's required to put our heads together and really discuss what does a better future look like. And so topic today, look, the leadership updraft. What do I mean by that? And I think we've learned a lot in a very compressed amount of time over the past few years in terms of what are the expectations for health and safety for our workforce in general. But as it relates to a joint employer environment, which I just define as any work environment that has two or more employers in a shared workspace to accomplish work, right? You have two employers involved. There's staffing, there could be contingent labor, there's contract, but generally that is what I'm meaning when I say joint employer. And the question is, what happens when leaders recognize that in order to solve a serious problem, they don't just reach out like adjacent to their CEO role or operations roles, they penetrate through the organization to ask for help. How do we solve these serious problems? And I've noticed that with our experience through COVID, it creates a bit of an updraft where ideas and solutions, a common focus on the common problem, and we start seeing both problem solving and acceptance. I just think about how quickly we were able to adopt a much larger work from home status and leveraging technology to solve some of these problems where we had that technology before COVID. Wasn't as readily accepted though. But having gone through that experience today, I feel like, hey, we're in a place where leaders are at a place where they realize they depend on health and safety in order to understand how do we better communicate to our workforce, to our customers, and what really matters comes into a much more clear focus. So when I think about just the, if there is a silver lining associated with COVID at all, here's an example. Our CEO, so Randstad's in 38 countries, based in the Netherlands, and our CEO and group reached out and said, how do we communicate health and safety, not just across all of our operating countries, but across industry, across our customers? Is there a framework that exists to create a common understanding and narrative talking points for how are we making decisions that impact the workforce? And so in the early days, our health and safety team was in a great position to respond to that. We developed a model. Well, we'd have to actually say we borrowed a model that was existing thanks to our friends at Niosh. And those of you that are familiar with the hierarchy of controls, that's what we presented to our leadership, just to talk about, look, when we think about making decisions around risk and coming to a better common understanding in a shared work environment, how are we doing that together? How are we creating protocols to follow together? And the great thing is look, we actually made an alliance between Randstad, Debeau, and Manpower, which previously in the realm of health and safety, we should have already been there. Good lesson for me to take forward is how are we partnering across industry and those that compete in the same space to solve common problems that are really important. So so that was important, and I have to plug Niosh again. Their work is just terrific. I love this group. Done so much to help contribute to the advancement of safety in the industry I work in. But back in 2015, there was this little study called Overlapping Vulnerabilities. And I think of vulnerabilities as kind of like work that's precarious in nature. So, Renee gave some great examples of that. But there really are unique risks that are specific to the contingent labor workforce. And I think one of the questions leaders should be asking and penetrating through our organizations is, how are we solving these problems? Can we solve it with the way we've been doing things? I don't think so. I think we need better. So look, just a couple of these bullet points as it relates to risks specific to a vulnerable workforce community is, we do see increased use in temporary workforce and companies depending on supplementing their workforce to accomplish work. We see that this is obvious, I think, to all of us on the call, that temporary workers are new in different environments more often than a traditionally employed worker. But it's important we think about this just a little bit more, because what happens when an employee is in a new environment, right? Disconnected from exactly how things are done, not sure and completely confident in expectations. But a temporary worker on a new assignment is not just a new employee. They're not just balancing being new. They're also balancing simultaneously what I call kind of the short-term unknown. It's precarious. They can be brand new and also having to balance how long is this assignment going to last. And this is important to understand, because this is connected to why some workers are willing to assume more risk than they should, to say yes to things that they shouldn't, in order to maintain employment. So we see, communication barriers and great studies that I think we don't have time to go into details here, but I've outlined them here. Terrific reads in terms just to validate these vulnerabilities, the precarious work, more in depth, but important for us to understand. And so at Randstad, one of the things that we have done, first of all, just the pandemic has really forced us to do a number of things in terms of looking at technology. We've always considered ourselves to be human forward, and we have a tech and touch program. How are we leveraging technology to earlier identify risk, make decisions? That still has been catalyzed. But the one problem that we are trying to bring a lot of awareness to, and how are we solving this problem, is how are we reducing serious injury and fatality to the contingent labor community. And for us, in our experience, we boil these down to what we call precursors. And precursors are just known conditions that precede a serious event. So if we have a fatality or a serious workplace event, these are some of the most common things we'll see, the gaps that shouldn't be there, but are there. And so we see compliance, we see non-standard work, and Renee touched on some things around the topics of definition, job description, and things of that nature. But when we talk about non-standard work, we have a vague work environment where assignment changes occur very, very quickly. We see variance between the type of risk experienced by the worker between first shift and second shift and even third shift is very, very different. Now, the employers that get together and decide to do work together evaluate the risks together at the beginning of the relationship, and most likely around what's happening on first shift. But the point is, how are the employers that agree to do work together staying connected to the level of risk that's presented at the employee level throughout the continuum of risk, right? Risk happens on a continuum throughout the work cycle. And that's been a big part of our focus. And of course, machinery and forklift or PIT is obvious, but the box on the bottom right is a very, very big thing for us in terms of how are we enabling the voice of the worker to, one, be more informed about the types of things that can hurt them. And when they recognize that, give them a solution to bring it to our attention. All right, this is a big thing. I actually call it a force multiplier, if you will. If we could have a magic wand and improve any one of these areas, that would be great. But I think the bottom right, employee engagement, enabling that, and technology has a big piece to do with that, but awareness of safety management systems does as well. So it's important that we bust a few myths from time to time. And regarding the type of things that occur before a serious injury occurs, there's been a lot of great work in this area. However, industry is still operating under the myth that if we reduce our minor injuries, there's a correlation to also reducing our serious injuries. We know that's a busted myth. That we know that no longer is true. That's the way I was taught as a safety professional. And then the slogan was, drive down your frequency and you'll drive down your severity. But the work by these two gentlemen is the work environments that employees are, hands on tools and boots on the floor. They're complex, right? They're organizational, operational, cultural, and risk fluctuates very quickly, right? And so we need to understand it's not just how employers are coming together initially to agree. Everybody wants good safety. That's the moral imperative. We all want that same thing, but where we differ is in our perhaps lack of capabilities, lack of technology, lack of understanding of what's required for two companies to evaluate and stay connected on how are we continually monitoring and assessing risk throughout the life cycle, throughout the engagement, so that we can make decisions, we can adjust, and we can keep moving. So here's just a quick visual. This is based on, again, Niosh's prevention through design. I don't have any good ideas on my own. I get everything from Niosh. So when we think about two employers, right, and we have a host employer that needs and depends on good staffing companies or good contract labor to come in and supplement the work along with them. Right, there's a procurement process, there's a vendor selection process, and that's pretty regimented. Compliance, insurance, those things are in place for a reason, are very important. There's underwriting, there's evaluation of each other's risk, and then it moves to kind of, all right, well, how do we start this up? Who's responsible for training, and this all occurs at the beginning of the relationship, but that's often the most important, that's the most emphasis on safety that we hear about until after an incident occurs. But what we want to understand is that, look, what two companies agree to in terms of let's enter into a business arrangement, let's staffing company to client, let's help you provide a better labor strategy, developing good business practices around how to keep the labor force steady and reliable. But what we agree to up here, our operations teams really do inherit, and often without any leadership involvement, without leaderships penetrating not just those around them. How are we really getting to the point where work is occurring and understanding the level of risk, the nature of risk? Is it acceptable or not? And so that's one of the things that we have been working so hard to advance, not just Randstad, a number of people in industry, and I'll get to that in a little bit. Here's what we want to think about is our friends up here in the scissor lift. The good news, no one was hurt during the shooting this picture. Actually pulled this from a website, so not the idea is, look, when we look at what's happening here, are these just bad workers in a system we're assuming to be good? Or are these just good workers in a bad system, right? And how we answer, how we think about this question indicates our approach to the problem. And I present this to you because look, we do need to think that risk is a continuum along the full engagement of the work cycle. And we have to be very, very aware of that. And it's the place for us to, I think, focus a lot of our improvement efforts on. I've heard comments where when a temporary worker is injured, I've heard comments such as, well, if you'd send us better people, this never would have happened. Or if staff employees, temporary workers, perhaps they're just even insulting intelligence, which is completely ridiculous. But the assumption is that the fault is of the worker, right? When the creation of risk is actually occurring within the system that the worker is within. People make decisions based on what makes sense to them at the time. And so a lot of our focus, a lot of our emphasis is on this box in the blue to the right. Fred Manuel is the work I referenced him earlier. He's the one that kind of pioneered, here's when serious injuries happen, let's pay attention to, and not assume that we can prevent a slip and fall and we're going to prevent all of our fatalities now. But his pioneering work, we've kind of tagged on and said, well, what does this mean when we have temporary labor involved? And how do we engineer our technology and our communication systems, our understanding from our sales and operations folks, so that we are all very in tune with when a worker is reassigned, that's a big risk. How do we continually inform and educate our customers, frontline supervisors that are often in a position to try to solve a problem and make a decision and pull one person from one area and put them on equipment that they're not trained on in order to solve a problem? But we've defined these things internally, and it's been very helpful for us. I would love to say that over the past 3.5 years, we've had 0 serious injuries. We've made significant improvements in the reduction of serious injuries by adopting an approach that has a newer view of safety that includes, look, where we're focusing on human and organizational performance. We're very specifically focusing on the risk that is most likely to hurt people the worst. And we're driving systems enablement, which means every system has limited resources, has defined boundaries. And when we have more than one employer sharing resources to some extent, right? Host employers have the resources within their site, but the staffing, the contractors also bring resources. Those can fluctuate. It's almost like it's fickle. Things can change quickly. How are the resources reliably connected within this group? And then the boundaries. Again, this comes up again. Staffing levels change. If there's vague job class or job descriptions, we're lacking boundaries about the type of work that should be and can be done. And why this matters is when we don't operate with the resources we need that's connected to the level of risk experienced by the workers, or we exceed the boundaries that are in place, the defined job descriptions, the job assignment, the staffing levels required to manage safe work, when we have we have a threatening to our resources, or we expand our boundaries, failure occurs very quickly. It occurs very quickly. So traditionally, the response has been, look, everybody's aggressively talking about safety after a serious injury, but what are we really doing to define and manage our resources and boundaries on an ongoing basis? And so we like to see that there's an interest, just outside of my profession or Randstad. This is an interesting study, 2020, that talked about, look, what's happening in the industry. What are employers expecting? Employers that depend on labor providers to help them complete work. What are they expecting in terms of health and safety? And what this report shows is that, look, the expectations for health and safety from the primary employers, the client or the host employer's viewpoint, is outpacing performance that's been traditionally supplied. So there's rising expectations. There's a bigger need for a greater understanding of safety. And I think we talk about collaboration, meaningful view of when an employer looks at a staffing company or a contractor. Is like, if the view is reluctant, or we just need them to come in and do something, that's kind of a low level view. And that's going to hurt business performance, whether we're talking about safety or accounting or anything. But when there's a higher level relationship, value on the relationship, that's the lever I think we have the opportunity to start pulling. So this was a very interesting study that I think confirms what we've been noticing internally for quite some time. And again, the idea is, look, this is our own kind of our own design that we share internally with our safety team. I apologize that it's a little wordy, but the point is that, look, we have on the left side, this is where it all starts. On the right side, this is where the work is actually happening. What are the specific things we're doing connected to management system, defining expectations? How will we stay connected as we anticipate risk will change, turnover will happen? How are we staying connected along the continuum of risk? And we've actually made an effort to simplify this a little bit. If any of you are readers or like podcasts, check out Sidney Dekker. He has a very simple concept, just called work is imagined versus work is completed, or blunt end, sharp end. You may recognize that. But the idea is, look, the left side of the screen is how we think work is going to happen. On the left side, this is our corporate entities. These are our employers that are in position to sign contracts and agree how work should go, and enter into the relationship, enter into what the operations teams are going to inherit. And then at the other end, this is where workers are. This is where work actually happens. But what we need to do is make sure we're putting in better systems, better expectations for performance that include leaders from both companies initiating, how are we staying in touch with the actual levels of risk? Is work happening like we think it is? And setting ourselves up for, rather than finding out something big just happened and now we have to respond under the guise of safety, but it's really claims and incident reporting, we start finding out about performance gaps that we can address ahead of the injury. That's what we want. And the biggest thing is that we're engaging the workforce and allowing, remember that box on the right, I said if we can pull one lever to promote the voice of the worker, to find out what's really going on, right? And to enable in an environment that's difficult for people to manage, being new and being a short timer, leaders have to engage and create this to happen. There's a role for technology, but there's really a role for, I think, safety management system frameworks. And so what I'd like to just kind of rest on here is look, we've drawn a lot of knowledge from Niosh. And as a safety professional, benefited so much from what Niosh's work has done. This is a new frontier for us to really, I think, make some good headway. And what should those that use staffing providers or contractors, what should they be thinking? What should staffing companies and contractors be thinking? What should we be embracing? And I boiled it down to these three things. So if you look at safety management systems, whether it's from ISO 45001, whether it is from ANSI Z10 model, there's others to mention. OSHA has done some terrific work in the realm of defining recommended management systems between multi-site employers or joint employers. In a way, these are consensus-driven expectations for safety performance. And industry's picked up on that. That's like a new expectation. And that's an important thing for us to consider. And I think it's, there's changing expectations and an expectation for better collaboration and performance, perhaps a new view for how employers work together and expect better performance. Right. And number two is, where do we make our best headway? Look, we just don't enable it at the beginning. We have to enable it at the beginning. We have to stay connected across the continuum of risk as employers. I think of two employers, it's easy to come apart. One employer has turnover with a safety sensitive role. How is the other employer notified of that? Because that changes risk. And then we need to make sure, look, how are we continually assessing these risks? How is an organization set up to really manage and inform and communicate risks on an ongoing basis? Each employer has a role to meaningfully contribute. There are certainly differences in terms of what a staffing company can really or should assume in terms of complete levels of training, management of the actual risk. They're not always in the work environment, but it is a shared work environment. It's a shared workforce. Both employers are in a role to meaningfully contribute. So I think about it. Look, again, I'll ask the same question I asked at the beginning. What happens when leaders recognize that in order to solve a serious problem, we have to reach down into the organization and ask for help? What does better look like? What's a better framework look like? How do we create this leadership updraft to create a better model to follow, right? And so here we are, we're the leaders. And what I'm grateful for, I think of the leaders at the American Staffing Association that are very intentional about how do we do better moving forward. I think about the leaders I've worked with at OSHA, certainly at Niosh, the American Society of Safety Professionals and National Safety Council, groups in insurance, consensus standards. We're all really recognizing the same thing. This is an environment, this is a community where we have unique risks and vulnerabilities to a precarious workforce. How are we as leaders creating a leadership updraft to start solving these problems? So thank you very much. And I look forward to questions. I think we do these at the end of the session, but that's our presentation.
Thank you very much, Scott, for that interesting view of from a global HR services perspective on work arrangements and well-being. And we will hold questions to the end. And now, Scott, if you will stop sharing your screen, we will invite Lorraine to join us at the virtual podium and share her screen and slides. Lorraine?
There we go.
Thank you, Sarah. And thank you to the participants here. I'm going to be talking about precarious employment and as one type of alternative work arrangement or contingent work. And similar to several other groups in our Center for Healthy Work, we characterize precarious employment as having one or more of these characteristics. And our center is also using a participatory action approach to our research. And this is one where we include community members and workers, community organizations, worker centers, and other partners throughout all phases of our research. So in developing our questions, in the data collection, data analysis, interpretation, and then actions that should result from what we've learned. And we really have embraced this as a cyclical research process, which should lead to new questions and then new actions. And I'll talk a little bit more about that at the very end. So why focus on precarious employment? So I think it's important to focus on this because workers engaged in precarious employment are more likely to be minority and foreign-born workers. They experience high levels of stress, and work in dangerous conditions that puts them at greater risk of injury and illness. They're also more likely to rely on social safety net programs and are more likely to experience discrimination. The other reason I think to focus on this is that our traditional approaches to occupational safety and health may not work with this workforce. Many of our current systems or enforcement are complaint driven. So, and this is across the board. If we think about OSHA standards or wage and hour standards, fair labor standards, or discrimination or equal opportunity standards, they all depend on workers complaining and then prompting an investigation. And people that are precariously employed really don't have the ability to complain about conditions at their workplace. Traditional approaches for health and safety have also historically or mostly been workplace or employer based. And again, precariously employed workers may not have a regular employer or a regular workplace. And then Scott just talked about a lot in detail about this, but many of our current laws are written for unambiguous employer-employee relationships. And as we move to more alternative work arrangements, those relationships become more ambiguous and in some cases can reduce workers' rights and access to health and safety protections or benefits, unemployment insurance, workers' compensation, and things like that. So I'm going to switch and talk, sorry, on the screen, about some of the research in our center. And so one of our projects is a community-based project. So we're really trying to understand precarious employment and its impact on health at the community level. And we're looking at two neighborhoods in Chicago that we've lumped together and called Greater Lawndale. And as shown here, Greater Lawndale is about 59% Hispanic and 37% non-Hispanic Blacks. This is a higher percentage of non-white residents than the city of Chicago, where it's about 29% Hispanic and 30% non-Hispanic Blacks. The two neighborhoods I'm talking about are on the southwest side of from downtown. And there's a high level of poverty in these two communities. About 35% of all residents live in poverty. And actually about 18% of employed residents work in poverty. Even those that are working full-time year-round, the poverty rate in Greater Lawndale for those workers is still about 10%. And this is more than 3 times higher than the rest of Chicago. Here I've plotted industry sectors by the US average injury rates, with the lowest injury rate industries on the left-hand side and the highest injury rate industries on the right. The dotted line is the sort of average industry rate across all injuries in the US. And this slide's pretty busy, but we see here that Greater Lawndale residents are overrepresented in higher hazard industries. So these are the darker bars on this. So when we look at the right-hand side of this, we see that residents from these two communities are more likely to be in high hazard industries, accommodation and food service, retail trade, manufacturing, transportation, and warehousing. And so in order to get a better understanding of what this means and how it affects health and both health of workers and health of the community, we used a mixed method approach to better understand this impact. And it included concept mapping, focus groups, key informant interviews, and then was followed by a resident survey. And with concept mapping, there are 3 steps to that, where we identified issues that influence the health of the community or the health of them, where we asked people really to brainstorm an answer to a question that was, when I think about my work situation or people who live in my community in similar work situations, one way work impacts our health, good or bad, is, and then they brainstormed a lot of ideas. We asked them then to sort those ideas into, we condensed that down to 55 items and then asked people to sort that into categories that made sense to them and then rate them in terms of how prevalent it was in the community and how much of an impact it had on health. We used concept mapping software that uses statistical and graphing methods. So each of these items, each of the small numbers are individual items, and they group together into 4 general themes. In that there was 1 sort of healthy description of healthy work, and then 3 that really would lead to unhealthy work. So residents, even residents that have experienced precarious work, can identify healthy aspects of work that might improve their mental and physical health. And this includes flexible work hours where they control the flexibility, decent wages, and supported coworkers. But we also identified systemic and structural inequities that were really focused, that influenced employment and health. And these included racism and immigration policies. And then lack of control and exploitation really arose in this, and then it'll come up in some other methods that we use too, looking at the power dynamics between workers and employers, being discriminated or harassed at work, violations of health and safety or other worker rights, and then even violations of sort of what we consider basic human rights, being able to access the washroom or the bathroom and having access to water while they're at work. And people told us stories about not being able to use the bathroom. And then cutting across all of this was this concept of stress. And this was both psychological and physical stress. And it was widespread throughout all our clusters. And it really was described in multiple ways as either an outcome or an exposure. And it included things like working too many hours, not getting enough sleep, physical pain from strenuous work, but also struggling to find and keep work, as well as working too many hours in order to just meet basic needs. We also conducted 12 focus groups where we engaged with community, our academic and community partners to do the data analysis and data interpretation. And we met with 77 community residents. And again, 3 main themes emerged, and they're very similar to what we saw with the concept mapping, that people felt that they were systematically marginalized from the pathways that would lead to decent work situations. There was a structural hostility to sustaining healthy work, and that was baked into the economy, particularly in disadvantaged communities, and that there were widespread violations in the rights, agency, autonomy of workers. And then a cross-cutting theme here that arose from our was really around investment in social resources that exist in these communities that would support healthier work or more decent work. And our key informant interviews resulted in similar findings. We did key informant interviews with community leaders and community-based organizations in these 2 communities. Across all of these 3 methods, we found that residents reported that many jobs cause stress, they have unpredictable schedules, don't pay enough to live on, and don't offer benefits, and are physically dangerous, and in many cases, emotionally unsafe. They also reported that employers aren't held accountable when wages are stolen or workers aren't valued, that workers can't really speak up against unfair treatment and are often pitted against each other for jobs. And that residents and key informants stressed the importance of community resources that were needed to sustain good jobs. And these were not specifically to the workplace, they were things like better education, job training, childcare, fair housing, and transportation. We then followed this with a quantitative survey where we enrolled almost 500 community residents, and one of the criteria was that they were adults, but they also had to be engaged in precarious work sometime in the past 2 years. About half of our sample was women and the other half were men. About half were Latinx and about 40% were Black. And some preliminary findings from this are shown here. And we found that 28% reported being on call or engaged in day labor or temporary work. About 37% reported that it was likely that they would lose their job in the next year. More than 70% reported that they didn't receive benefits, and 78% reported that they would not get paid if they missed work. And nearly a quarter of people we surveyed had experienced wage theft. And these were data that were collected pre-pandemic. We don't have quantitative data post-pandemic. We have some additional qualitative information about post-pandemic. We did ask, similar to the what Renee presented at a national level, we asked questions about mental and physical health. And we did see that poor mental health was associated with wages that varied a lot, less flexibility in schedules and regular changes to their work schedule, and a likelihood of job loss or having experienced wage theft. And that poor physical health shared some of these same associations, but was also associated with on-call, day labor, or temporary work. And that really was the increased risk of exposures on the job. We also modeled the association between employment precarity and occupational exposures. So we used a similar precarious employment score. And we found that first, there was a high prevalence of precarious employment in our sample because we targeted our sample towards people that were precariously employed. But we also found a high prevalence of self-reported exposures to occupational hazards. And even within a precariously employed group, we found that increases in employment precarity were significantly associated with increases in exposure to chemical and biological hazards, physical hazards, and slip, trip, fall, trap, and crush hazards. And so this suggests that some of our observed health inequities among precariously employed workers or racial and ethnic minority workers may be partly explained by the increased risk for exposure to higher exposures to occupational hazards. Another project in our center is looking at these same kinds of questions, but taking a more systems level approach or an organizational approach. So they conducted a number of interviews with organizations, primarily in the labor and health or healthcare sectors, and found very similar results reported from those key informants. Which really leads me to, I'm going to just use the last few minutes of my presentation to talk about some of our actions. So our interventions as part of our center. The systems level change group, the group that was looking primarily at bringing together public health, healthcare, and labor organizations to try to remove some of the silos of addressing the health implications of precarious work. So they engaged in a collaborative learning experience that took place over several months, and they had representatives on teams and we provided the workers' centers, labor unions, and the university provided technical assistance and facilitated trainings to better define precarious work and develop action plans for implementing policy systems and environmental change initiatives. And it focused on understanding the problem, system strategies and approaches, and then developing a theory of change. And we had 9 teams that worked on this, and they each came up with a plan, and we provided some pilot money for them to initiate their action plans within their organizations. And I'm just not going to describe all 9 of them, but one of them is listed here. This is one example where the Cook County Department of Public Health partnered with 2 worker centers and developed 3 goals for the project, and then engaged in a number of activities. And so their activities really involved reaching out to community residents to provide some know your rights training for workers in precarious employment situations, and then really trying to develop a strategy for asking the right questions. So really trying to develop questions that could be used in conversation with workers that focused on how labor violations affect health and the livelihood of the workers and their families. And then also centering their educational materials. So they have a workers' rights curriculum, and this was the CTU group has a workers' rights curriculum. But they, after this experience and the learning that came with this, they recentered that to also focus on issues of wage theft, retaliation, paid sick leave, minimum wage violations, and immigration rights. And they also really identified the need to have better data to support policy and systems changes. So as a group, they are really working on how to beef up the data collection and the use of evidence in their strategies to affect change. Back to the Greater Lawndale project, we used all of the evidence from our mixed methods health assessment to really engage in a community-based strategic action mapping process. And so we've developed a roadmap that includes actions towards building power, to change expectations around work and create awareness, to building community capacity, and then to building equity as our ultimate goal. And our primary intervention was really a formation of a community academic council that includes community residents and representatives from community-based organizations and from worker centers. And it's co-chaired by 2 community-based organization representatives. And they then just determined the sort of strategies and actions that would take place within this roadmap. And our initial set of 3 initiatives that took place, actually surprisingly effectively during COVID, were an awareness campaign at the community level with the goal of really changing the dominant narrative, which right now is that people should feel lucky to have a job, to a more inclusive, that everyone deserves healthy work. And this includes a number of activities, including the development of a Greater Lawndale Loteria game, which is a popular game that's played. It's sort of a bingo kind of game, but this is all about worker rights and different job or employment conditions. There was another subcommittee or group that was really looking at the barriers to accessing workers' compensation among precariously employed workers who were injured on the job. And then the third group really was looking at policy analysis of barriers and facilitators of self-employment and entrepreneurship in the community. And they developed a series of workshops about forming and sustaining cooperatives. So these are examples of things that we've done that are very, specific to Greater Lawndale or the Chicago area. But we think that this approach in developing and implementing interventions could be replicated in other communities. And because they arise from the community and have a lot of community involvement, we also think they would be a more sustainable approach to interventions within to address precarious work. And that's all I have. So I'm also happy to answer questions. I'm going to turn on my camera now and I guess stop sharing and turn it back to Sarah.
Thank you very much, Lorraine, for that excellent presentation on the critical work you're doing. And now we're ready to move to the Q&A portion of today's webinar. I'm going to turn it over to Nicole Edwards. Nicole?
Thank you, Sarah. We'll bring in the Q&A portion of today's webinar, and we ask that you submit your questions in the Q&A box. If there's a specific presenter you'd like to answer the question, please mention them by name. Please try and avoid the use of abbreviations or acronyms in your questions. So moving into the questions, the first one is, I think this is addressed to everybody. It came in during Scott's presentation though. There's an emerging risk factor between total worker health, physical, mental, financial, and increased stress and fatigue that are increasingly identified as root causes to incidents as we return to work after the pandemic. Are there any recommendations for addressing this issue in a multi-employer workplace where employers have varying support resources? And anybody who wants to can grab that question.
Look, hey, this is Scott. I'll grab that. What I can say is that, look, when we think of the the state of our employees, all going through changes in work and things such as a pandemic, we could say that our wellness programs, we could see how the emphasis on psychological safety, wellness changed. And so internally, what that looked like for our employees is how do we integrate? We don't just have concerns within the entire group. We have different groups that have different concerns. And so one of the things we did is leveraged our business resource groups. So for example, our business resource group for Abilities in Motion. Abilities in Motion are a group of friends that may have different challenges with mobility, neurodiversity. That's a need, and how are we allowing conversation, focus, listening? And it's been terrific, whether it was with our Abilities in Motion or other business resource groups. We have military resource group, we have African American heritage business resource groups. So by addressing the whole, we recognize there's different groups within the whole that have different concerns. So, and burnout was a big thing. We saw our leaders address that. And before, you know what, you would see people taking PTO, taking time off, and then they'd show up in a meeting. That changed, right? That really changed. When we're off, we need to be off. And so there was a different intensity and focus on kind of the social and the psychological well-being, meaning that burnout's a real factor. It's a very big concern. One of the things I like seeing is that, you know, ISO 45001 came out not too long ago. And just, I think, in the past 18 months, we see ISO 45003 that's specific for health and mental wellness, right? Addressing total worker health aspects. So yeah, we could say, look, I see meeting overload here in the notes. It required us to kind of reframe. We may have had written programs in place to say, take your time off. If you have a concern, let us know. But we really had to create that time and make sure people felt comfortable and supported, whether it was in a big group or small group.
Okay, would any of our other presenters like to chime in there? And if not, let's move on then to the next question. This could go to Renee or Lorraine or even Scott. We're interested in hearing about burnout / mental stress and the loss of productivity due to telework and pandemic-induced constant multitasking between virtual meetings and multiple projects. Also increased cadence of meetings since the pandemic, meeting overload.
So I guess from our end, the studies that we're working on, the workers that we work with mostly are not so much engaged in sort of this online, and many of them either had critical jobs where they continued to work in factories during the pandemic, but there was clearly a lot of extra stress associated with workplace outbreaks. There is a disproportionate, again, impact in many cases in that the jobs that workers have in these communities are jobs that are more in-person jobs. So they didn't have the option of working remotely in many of the cases we had. So, I mean, I have lots of personal stories of being at a university and the burnout and mental stress associated with that, but our research really doesn't address that kind of work so much as the more factory construction and people either that lost their job and had the stress associated with that, or continued to work but did not have the option to work from home.
Okay.
Yeah, I wanted to say that we started looking at data from the pandemic, and again, I agree with Lorraine that those who were teleworking are significantly different from those who weren't able to telework, at least during the pandemic. And the other challenge, of course, is what types of data are available. I mean, data that have a lot of detail on the kind of indicator of flexibility. It might not have a lot of detail on the health effects. So I don't have something specific to mention, but we have started looking at this data.
Okay, thank you, guys. Let's see. Here's the question for all. Given the realities today, are stable jobs even possible?
So I will make just one comment that comes to mind immediately. Perhaps, and I said a couple of times in my presentation that standard workers in standard arrangements, and this is, your regular full-time job with benefit, expectation of continuous employment, etc. Perhaps one strategy is to look at what it is that makes these jobs good, right? So I don't know, stable necessarily, that's one aspect of it. But there are conversations and policy efforts and what have you for, say, portable benefits. So what are the kinds of things again that make the standard kind of arrangements desirable? Can we mimic those things, those aspects? So in other words, the worker changes jobs perhaps more frequently than the worker wants, but is able to carry with him or her, the kind of desirable, some of the desirable kind of packages that would be covered by a standard arrangement. That's my first reaction to this.
Yeah, I'd agree with Renee, and I'd add that, when we think of agility in the workforce, we think of the Gen Y and Gen Z is the largest group in the workforce today. We have 5 different generations throughout our collective workforce. The biggest portion is now Gen Y and Gen Z. And what is their expectations for work? Randstad did it's called our Workforce 2025 monitor across several different countries, asking, do they prefer traditional employment arrangement, one employer just locked in, and that's what reliable work means? Do they like the freedom of kind of leveraging flexibility between several different employers, assignment based, and significant preference for agility and options between many employers is what stability means to them. So I think that's an important part to consider when we think of reliability in work.
Okay, thank you. We're going to direct this one to Lorraine. What does it mean deserves work? The work needs to be of value in order to generate benefits. A job that is value added will naturally have benefits provided to protect the worker and keep them productive. You can't wish these through government edicts.
So I think maybe there was a misunderstanding. I said that people deserved healthy work. I think the idea of deserving work, most of the people we've talked to are working. They're just working in highly exploitive situations. And I think that is not good for those workers. And it benefits maybe employers and some others, but I'm not sure that businesses should be able to operate in a way that is highly exploitive and where people are at risk for injury. Those injuries or illnesses or stressors, the impact of those jobs permeates beyond the worker. It affects their families, it affects the communities they live in, and it affects all of us. So I do think that we need a better system where workers that are working, people that are hired to do jobs deserve certain basic rights associated with those jobs. Those jobs should be productive, they should be safe and healthy, they should provide for a decent standard of living, and if so that's sort of the goal of what we're looking at, is how to restructure jobs in a way that people are valued for the work they do.
Okay, thank you. What additional national collaborations are being planned or discussed among safety and health, as well as community and health agencies for creating standards for precarious workers?
I don't know if there are national collaborations. I know that there are a number of organizations, and several of the total worker health centers are now really focused on this issue. And as a team, we meet regularly with Niosh. So I think there are opportunities for some of that. I don't know that there are any specific things I could point to as a national collaboration yet. But I do know that in the expansion from 6 centers to 10 centers, there is a broader set of groups that are addressing precarious employment in various ways. Some of us looking at mental health specifically. Some is, in our case, we're looking at really around what, interventions that could be done outside of the workplace in many cases. And then some are looking at traditional health and safety risks among precariously employed workers. So I don't know that there's any specific collaboration I could point to now, but I do think we have an opportunity with the size and scope of people, both internal to Niosh and external to Niosh, that are looking at these issues.
Yeah, I agree. I'd love to say there's already a well-formed, powerful group that's in place, pulling all of the knowledge from academia, insurance, business, compliance, and regulatory. So look, from my perspective, that's a great question, by the way. Thank you for that question. From my perspective, we hear urgency and curiosity and a desire for what better looks like in health and safety in this environment from business groups. And it could be within a manufacturing association, it could be within a logistics or transportation group. Trucking is a huge thing, right? Transportation, healthcare. So you see it like in segments. And then with our Niosh NORA work groups, the National Occupational Research Agenda has contingent labor work groups, collection of academic, insurance, safety professionals, business, industry groups, such as ASA is a part of that. And so we see that with our contingent labor worker, who is just, by the way, put together a host employer document that has collected information from safety, from regulators, from academics, to make the effort to inform host employers what does better look like when it comes to caring for a vulnerable workforce, contingent labor workforce. So we see these things happening. They're emerging. I kind of think of it as the scuba diver underneath the surface trying to come up for air, right? And I think we can see the surface, but we don't really have a defined collective group yet. I can say 3 years ago, we didn't have a liaison between American Society of Safety Professionals and the Niosh NORA work group. We do now. So the connections are being made. That's really important to do. How we put together a big group like that, I think probably requires some more discussion, and I would love to be in on that and hear what people think.
All right. We are out of time as far as questions go. So thank you very much to our presenters. Sarah?
Thank you, Nicole. And I want to thank our excellent panel of speakers for helping us kick off our 2022 webinar series. We hope we'll see all of you at the next webinar series. And to make sure you get the latest news about this webinar series, you'll please visit our Expanding Research Partnerships webpage to receive email updates. And we're going to post that address and link in the chat. And I'll turn this back to Nicole to close this out. Nicole?
Yeah, the link for the online evaluation of today's webinar is going to be put in the chat box if it hasn't already. And please take a moment to provide feedback on today's event. We will use this feedback to improve our future webinar offerings. And please contact the Niosh Office of Research Integration at ori@cdc.gov about the availability of this webinar recording. Finally, the next webinar in this 2022 Expanding Research Partnership series will be on June 8th. More information will be available on the Niosh Expanding Research Partnerships website soon. Thank you and stay safe, everyone.
Thanks, everybody. Bye-bye.
Thank you.